Ramadan is a time for spiritual reflection, but for many of my patients, it's also a time of high anxiety regarding their health. Here are a few of the concerns I hear. Will I lose my progress? Why did I gain 10 pounds last Ramadan when I wasn't even eating all day? And the biggest question recently is it safe to take my GLP-1 or GLP-1 GIP medications or diabetic medications while fasting? Ramadan fasting is one of the most powerful forms of intermittent fasting. But here's the surprising truth. Some people lose weight during the month of fasting. Some actually gain weight, and many stay exactly the same. And it has very little to do with fasting itself and everything to do with what, how, and when you eat during your eating window. Hi, I'm Dr. Bazgha Khalid, and I'm an internal medicine and obesity medicine doctor. As a weight loss doctor, today I'll show you how to use fasting to support your metabolism, not sabotage it. So if you're wondering what is Ramadan, Ramadan is the 9th month of the Islamic lunar calendar and is a time of deep spiritual reflection, empathy, and self-discipline when Muslims all around the world fast from food and water from dawn called Sahur until sunset called Iftar. So how about the weight trends during the month of fasting? Most people assume that not eating for 12 plus hours for a month leads to automatic weight loss, but clinical data shows a very different story. The weight reality is that some people lose weight. However, it happens only if you maintain a calorie deficit and high protein diet during your eating window. Some people maintain weight. This requires eating mindfully during your eating window. And then there is a group of people who actually gain weight despite 30 days of fasting. Now, this is surprisingly common, and I have been a culprit of this myself, as I rewarded myself with all the fried, fatty food at the end of the day. So, the reason for weight gain despite fasting is that fasting does not automatically mean a calorie deficit. Weight gain despite fasting is due to rebound hunger. When you break your fast with high sugar, high carbohydrate foods, think of deep fried appetizers, pakoras, samosas, and sugary drinks, your insulin spikes aggressively. Because you've been fasting, your body is primed to store energy. That massive insulin spike tells your body to store everything as fat immediately. Combine that with low activity and a slowed metabolism, and the scale goes up despite the fast. Let's look at the clinical studies and the science. Clinical studies on 30-day fasting show that it can improve inflammatory markers and oxidative stress. However, a study published in the Journal of Nutrition found that without calorie control, participants often increase their intake of saturated fats and sugar during the night, neutralizing the benefits of fast. The key takeaway from research is that fasting is a tool for autophagy or cellular cleaning, but it only works if the quality of food during non-fasting hours is high. So why people gain weight during Ramadan? It's because of large, heavy iftar meals, fried foods, sweets, sugary drinks, eating very fast after long fasting, late night snacking, low protein, low fiber meals, and reduced physical activity. In the name of celebration, Ramadan food becomes more calorie dense than the rest of the year. Therefore, weight gain despite a month of fasting is quite common. Please share your experience. Do you lose weight, gain weight, or maintain your weight after a month-long fasting? So why people lose weight during the intermittent fasting? This has everything to do with what, how, and when you eat during your eating window. Here is what helps. Controlled portions, higher protein intake, more home-cooked food, less snacking, improved insulin sensitivity, and structured eating windows. Ramadan fasting can support weight loss, but only if done intentionally. How about metabolism when fasting? Here are the changes that happen during fasting. Insulin level drops, fat burning increases, glycogen stores empty, and hunger hormones fluctuate. But what you eat at Sahur and Iftar determines whether fasting works for or against you. The most important nutritional rule in fasting is protein and fiber first. If you remember one thing from this video, please remember protein and fiber are the non-negotiable during your eating window. If you're wondering why protein matters, protein preserves muscle, controls appetite, reduces overeating at iftar, and supports your metabolism. Why fiber matters? Fiber slows digestion, improves blood sugar, prevents constipation, and improves fullness. Let's talk about a perfect sahur. Now, do not skip sahur, as skipping sahur almost always backfires. Perfect sahur formula would be protein plus fiber plus healthy fats and lots of hydration. Here are a few sahur meal ideas: eggs with vegetables and sourdough bread, Greek yogurt with chia seeds and berries, cottage cheese with nuts and fruits, protein smoothie with oats and seeds, lentils or chickpeas with olive oil. A good sahur should keep you full for several hours. Share in the comments what you like to eat for sahur. And here's what I would avoid for sahur: white bread with jam, sugary cereals, just tea or coffee, and store bought cookies and pastries. Let's talk about healthy iftar: how to break your fast properly. The biggest mistake is eating too much and too fast, so mindfulness is key. Step by step, ideal iftar would be: break your fast gently with 1 to 2 dates and water, then pause for a few minutes. During this time, pray, give your stomach a 10-minute break, and then eat your protein first. This could be grilled chicken, fish, tofu, lentils, and then eat your fiber next. These could be vegetables, salad, beans, lentils, and then your carbohydrates last in the small portions. And these could be brown rice, quinoa, or whole grains. Let me know in the comments what you're planning to eat for iftar. So, what to do during 30 days of fasting to maximize health benefits? Do's are: walk after iftar, strength train 2 to 3 times a week, sleep consistently, 8 hours is a magic number, hydrate aggressively between iftar and sahur, and eat mindfully. And avoid sugary drinks, fried foods daily, huge late night meals, skipping proteins, and skipping sahur. I want to hear from you. What is your biggest struggle during Ramadan? Please comment below. Now comes the most important question: fasting with diabetes or GLP-1, GIP medications. If you are on diabetic medications, especially like insulin and sulfonylureas, there is a risk for hypoglycemia or low blood sugar with fasting. So, what to do? It's very important to talk to your doctor before fasting. Please make sure it's safe for you to fast. Your medication dosing and timing may need adjustment. Monitor blood sugar closely and break fast if hypoglycemia or low blood sugar occurs. If you are on GLP-1 or GLP-1 GIP medications like Wegovy, Ozempic, Zepbound, or Mounjaro, then fasting is possible but requires strategy. These medications already slow your stomach. Fasting slows it further. Therefore, you have to be mindful and intentional and make sure to stay very well hydrated and hit your protein goals. Watch out for nausea, dehydration, low appetite that causes low protein intake, and constipation. Smart tips while on GLP-1 medications are: eat protein even if you're not hungry during your eating window. Hydrate aggressively, avoid very fatty meals, eat slowly at iftar, and don't skip meals entirely, and prioritize protein and fiber. Many patients do very well fasting on GLP-1 medications, but guidance and mindfulness matters. If you have been on GLP-1 medications during a fast before, share your experience. Your personal experience may help someone else on similar medications. Let's talk about some myths versus facts. Myth is Ramadan automatically causes weight loss, while the fact is only if nutrition supports it. Another myth is skipping sahur helps weight loss, while the fact is skipping sahur actually increases overeating later. Another myth is dates are unhealthy. Fact is dates are fine in moderation. Another myth is fasting for 30 days will break my metabolism. Fact is your metabolism only slows if you stop moving and stop eating protein. Another myth is I can eat whatever I want at iftar because I fasted all day. Fact is your body is more insulin sensitive after a fast, meaning it stores sugar as fat more easily. Therefore, what you eat when you break the fast matters. Let's talk about some questions to ask your doctor. Can I safely fast? Do my medications need adjustment? What signs should make me break my fast? How much protein do I need? what symptoms to watch out for. Ramadan is a marathon, not a sprint, and fasting can be incredibly healthy or unhealthy. The difference is intention, planning, self control, and discipline. Focus on the three eights: hydration, high protein, and healthy habits. If you found this video helpful, hit that subscribe button and share this video in your family group chat. Until next time, stay healthy, stay mindful, and Ramadan Mubarak.